Next chapter is cholinergic drugs. In this, we have two things. Either it will be sympathetic or parasympathetic. In sympathetic, it will be like heart will be stimulated and rest all part will be inhibited. In parasympathetic, only heart will be inhibited, rest all will increase, right? So in sympathetic, it will be like heart increase and then bronchodilation, okay, constipation, decrease urine outflow, okay, decrease secretions, mydriasis will be there, and ejaculations will be there. Shoot and point is there. Shoot means ejaculation. In parasympathetic, first its heart is negative and rest all will constrict, right? Bronchoconstriction, diarrhea, increase outflow, increase secretion, and then it will be meiosis and then erection. So there it will be erection, there it was ejaculations, right? So this is done. So the question has come: which of the action is expected to be stimulant of muscarinic receptor? That is erection, right? Then we have what is botulinum toxin and physostigmine. So botulinum toxin, it is a release of acetylcholine from the neuron into the synapse. That will be mydriasis, and then we have physostigmine, that will be opposite to para, right? Then we have parasympathetic. We have cholinergic receptor. It is two type: muscarinic and nicotinic. In muscarinic, we have three things: stomach, heart, and any other place, right? In stomach, we have M and N. In M, we have M1, M2, M3. M1, we have stomach, which will increase secretion. M2 will be heart, that will decrease heart rate, that will be bradycardia. Third will be it will present almost everywhere, right? So increase in the heart, it will decrease, which is M, and then which will present all over will be I, broncho, GIT, everything. Then M4, M5, right? All five muscarinic receptors are present in the brain. Then we have nicotinic receptor. It's the one which is NN and M. And N is the one which is present at ganglia, which is like a junction of two nerves, right? SNS and PNS. And NM is the one which is present as NMJ receptor, which will require optimal stimulation, right? Then we have two drugs, directly acting and indirectly acting. Directly acting will be pilocarpine, indirectly will be ACHE. In the indirectly acting cholinergic drugs, which was ACHE inhibitors, in this we will have two, reversible and irreversible. Reversible is used commonly, irreversible is the permanent one. Then in the reversible, we have two types: lipid soluble and water soluble. So lipid was the one which would cross the membranes and that would be soluble. So 5-zoostigmine, SO is there in between. In water soluble is the one which is neo. So that means not soluble, right? N is there. So now we can see what's Alzheimer's disease. In Alzheimer's, we have three drugs: donepezil, rivastigmine, galantamine, right? So in all these things are used in physostigmine. In physostigmine, it is in this there will be eye drop, meiosis, ankylosing glaucoma. In physostigmine, drug of choice is atropine and poisoning, right? And other drugs for Alzheimer's, we have memantadine and aducanumab, right? Then we have water soluble drugs. In this we have what? In this we have neostigmine, pyridostigmine, atrophonium, right? So in this we have so don't confuse it with physostigmine. Physostigmine is different, in which there will be Alzheimer's, donepezil, rivastigmine, all these things will be there, right? And so for other drugs, Alzheimer's disease will be memantadine, aducanumab, right? But water soluble, we have three things: neostigmine, pyridostigmine, not physo, pyridostigmine, and atrophonium, right? Then we have is we have myasthenia gravis. So what is myasthenia gravis? In this, first we can see in this there will be muscle weakness. Okay, so if it increases, then it will be like cholinergic crisis, and if it decreases, then it will be myasthenia gravis. Okay, so we have test that is atrophonium test, which should be less than 10 minutes. So this they can ask. Okay, then we have aducanumab. Okay, adu means Alzheimer's disease, U means underlying cause, UC means underlying cause, A is A beta amyloid, MAV is monoclonal antibodies, right? Then we have cobra bite. Cobra is same as myasthenia gravis, right? So this is a neurotoxic snake. NMJ is there, muscle weakness. In this it will be both neostigmine plus atropine, right? A person was given a muscle relaxant that competitively blocks N receptor. Which of the following drug is used for reversal? So for reversal after surgery, it will be neostigmine, right? So this is what we can say. Then again a question came out, a diabetic patient developed post-operative urinary retention, which of the following drug can be used for short-term treatment? That will be bethanecol, right? Okay, then we have irreversible. So this is usually asked. Okay, in irreversible, this is not to treat. Okay, in this we will have what a farm will be there. Okay, and organophosphates are there. So in this, the atropine is the drug of choice, and this in this we can have malathion, palathion, that will be ACHE inhibitor. Okay, then it will increase ACH and M1, M2, M3. Then it will do what? In M1 it will increase, M2 that decrease HRBP, M3 it will do pinpoint and increase secretion, right? So atropine can reverse all symptoms of opioid poisoning except muscle weakness. Okay, atropine is the one which is the drug of choice, life saving. Okay, blocks M1, M2, M3, but except muscle weakness. In most of the cases, muscle weakness is seen after other symptoms have subsided, right? Then what do we have is we have ACHE reactivators. Okay, in this we can see in this what we can see is we have peripheral and diacetyl monooxamine. Okay, peripheral dioxazine will be like both brain and periphery. In this, oximes will reactivate the enzyme, right? So oximes will be there. And so regarding neostigmine, what we can see here is in neostigmine there is one in myasthenia gravis. What muscle weakness is there? If it uh, if it improves, it will worsens, then it will cholinergic crisis. If it improves, like if NM is down, then that means it will be myasthenia gravis. If NM is up, that means cholinergic crisis, right? So this we can see neostigmine, we all know. Okay, first NM with the muscle relaxation, and M1, M2, L3, SCL, HR, and diarrhea, like these things. Okay, so now we can see nicotinic and muscarinic uses. Okay, in nicotine, it will be there in myasthenia gravis, cobra bite, reversal of muscle. But in muscarinic uses, it will be post-operative paralytic ileus and post-operative urinary retention, right? So this was all about this. Then we have anticholinergic drugs. That will be we will have many things. Okay, so what we can see is in anticholinergic we can see three things: M1, M2, M3. Okay, and in M1 what we have is SCL, acid will increase. Okay, and acid will decrease. It in this it will be peranzapine, talenzapine, right? M2 means what? M2 means it will be bradycardia and AV block, that will be atropine, which is the drug of choice. M3 is bronchus, which is asthma, COPD. In this it will be ipratropium, right? So it will be ipratropium inhalational route, and also it will be there in COPD, asthma, lungs, right? And M2 is there, which is bradycardia, AV block. In this atropine is the drug of choice. In this it will be contraindicated in angle-closure glaucoma, right? And then in the M3 one also it was like mirabegron, so mirabegron, like this it will be there, which is used in also overactive bladder, which will be soft, right? Solifenacin, oxybutanin, floxonate, tolterodine, right? Like this it will be there. Then we can see advantage and disadvantage of M3, which is meiosis. So we have glaucoma, angle closure, and then advantage is fundoscopy. Okay, then we have cycloplegia. In the cycloplegia what we can see is it is the one, and then it will like, for example, atropine, hemiatropine, okay, tropicamide, all these things will be there in the adult. Okay, so atropine is there in the child. Okay, not other effective, but for adult we have another. Atropine will usually in the child, right? And we have refraction test in the cycloplegia. This is the advantage, and if it is blood, then it is disadvantage. Then we have adrenergic drugs. In adrenergic, what do we have is, so we have alpha and beta, in alpha 1 and alpha 2, beta 1, beta 2, beta 3. In alpha 1 we have usually we have three things: blood vessel, eye, and prostatic urethra, right? So in alpha means what? This will increase. So blood vessel, this will increase, vasoconstriction, right? Eye, it will decrease, so that will be mydriasis, right? Then we have prostatic urethra. In this it means urine will decrease, right? So this was the alpha. And then we have alpha 2. Alpha 2 will the break. Break means what? It will decrease all H, heart rate, and BP, right? So all will be the same. Then we have beta. In beta we have three things: beta 1, beta 2, beta 3. In beta 1 we have what? Heart HR. Okay, HR will increase, and JG cell, this will also increase. Okay, so heart rate. Okay, so in beta 1 both will increase, heart rate and GE cell. In beta 2, B2, what we have left? We will have three things: lungs, blood vessel, spindles. Okay, so lungs, it will be what? Dilation will be there. It first was constriction, second was dilation. Lungs, vasodilation; blood vessel, vasodilation; liver, we have uterus and all these things. Then we have B3 will be bladder, that will relax, which is overactive, right? So now we have alpha and beta, we are done with this. Okay, alpha 1 was all constriction, beta was breaks, alpha 1 was all constriction, alpha 2 was breaks, in beta 1 was constriction, in beta 2 it was all vasodilation, and 3 means relax. Okay. So this is how we can see the things. In this we can see, like, okay, so what the first is the cocaine, okay, and which is the reuptake, second is the break, and third we can see is the alpha 1. Okay, so then we have receptor. For example, we have uterus, it relaxes the uterus. Okay, blood vessels, dilation and all. And then we have liver. Yeah, this is important. Liver, it protects from hypertension. Okay, in this there will be hypoglycemia, this is important. So beta and beta 2, beta 3, in this it will give a warning symptom. Okay, 1 2 3. One will be heart rate and palpitation will be there, second it will be tremors, third it will be sweating, right? Which third will be like not effective. So yeah, so what it will do, it will increase sugar in liver, and due to this person do not go in coma, right? So then we can see if it was like, if like beta is contraindication. So if beta is contraindicated, okay, so beta should be contraindicated because this, and if beta is contraindicated, then beta 2, beta 1 and 2 will not be work, then no warning symptoms. Okay, and no increase in liver and no coma, all these things will be there. But for warning signs it was like this. Okay, then we can see indirectly acting sympathomimetic drugs. In this we have cocaine, and cocaine is the one. Cocaine means that will be vasoconstriction, which will increase the BP. And AN we have, that means it will be E is vasodilation, which will decrease the BP. Then we have local anesthetic also, and then it's erective. And in this there will be no bradycardia. We will have sympathetic symptoms. Okay, like arrhythmia, increased heart rate, AMI, BP, all the things will be increased. Okay, it is erective, local anesthetic, and VD. Okay, it will decrease the BP, right? So all these things are there. And also we can see in the in the uptake indirectly acting one, we can also see first is the cocaine bugs, then we can see pellet and perforations, and then we can see jet black tongue. Okay, so this was the indirectly acting sympathomimetic. Now directly acting sympathomimetic, in this there will be catecholamines. So non-catecholamine you can take orally, but in catecholamines it will be two things: endogenous, exogenous. Endo means dopamines. Okay, dopamine. So in this there will be three things: dopamine, non-adrenaline, adrenaline. This will be of the endogenous. In the exogenous we will have three things. So not exo means it's outside. So in this there will be no D. So no D1 dopamine. So dobutamines will be there, right? So in this there will be beta 1 and CHF. Phenol dopam means D1 only, and then we have isoprenaline, right? So these things we have: endogenous, exogenous. Endo is dopamine, DNA. Okay, endo means DNA, dopamine non-adrenergic, adrenergic, right? And that will be dobutamine. Rest you can understand. Then what do we have is in this you can see D1, beta 1, alpha 1. Okay, in D1 what do we have is less than 2. Okay, beta means 2 to 10, alpha means more than 10, right? All these things are there, right? In D, so I was talking about dopamine. So in dopamine we have D, beta 1, alpha 1. Okay, remember is dabba, DBA. Okay, D means in this there will be renal, blood vessel or vasodilation in the D. In beta 1 we have, it will increase heart, and then alpha 1 we have BV, VC, BP. Okay, that means it will increase the BP, right? More than 10. Also if you have you can remember, like, it's low dose, intermediate dose, high dose. Low is less than 2, intermediate 2 to 10, high dose is more than 10. Okay, then this also there can be shock, oligomnia. Okay, drug of choice can be there. Okay, then if we move forward, then we can see what Non-catecholamine, in non-catecholamine we can see alpha 1 receptor, that will be phenylephrine eye drops, which will be only used for mydriasis, right? Then we can see alpha 2 receptor. Okay, see for alpha 1 receptor in blood vessels, hypotension, in hypotension we can see methoxamine, right? And if it is nasal congestion, then we can use zoline, right? Oxymetazoline, xylometazoline. So in nasal congestion we can use zoline, right? And if we have, that was for alpha 1. If we come to alpha 2, in alpha 2 means hypertension. So alpha 1 was hypotension, here it will be hypertension. For treatment of hypertension, what do we use? Clonidine and methyl dopa. Clonidine and methyl dopa, it was for hypertension. Then we have beta 2, right? So beta 2 receptors, we have two things, either long acting and short acting. Okay, so in beta 2, this is given in bronchial asthma in the inhalational route. Okay, so short and long. Short means salbutamol, terbutaline. ST. Short is there na, ST. Salbutamol, terbutaline. And in the long acting, we have salmeterol. It was salbutamol. Here it will be salmeterol and formoterol. Okay, salmeterol, formoterol, it's for long acting. Salbutamol, terbutaline, it's for short, right? So alpha 1, alpha 2 and beta 2 is done. Now what do we have is beta 1. Okay, in beta 1, what we have is there are no drugs. Okay, potassium goes inside. Okay, and then that will lead to kalemia. Okay, which will be hypokalemia, right? Hyperkalemia, sorry. So in this it will be what? In beta 1 we will have ritodrine isoxsuprine, that will be for the uterus, for uterus relaxation, and in this it will be preterm labor. Okay, ritodrine isoxsuprine, uterine relaxation, preterm labor, right? Then we have side effects we can see in this. In beta 2 side effect, in which there will be no hypoglycemia. So 3 T's we have: tremor, tachycardia, T-wave changes. Okay, in this will be always hyperglycemia, right? Okay, so this we have seen. Now we can see one table. Okay, non-adrenaline, isoprenaline and adrenaline. So non-adrenaline means alpha 1, alpha 2 and beta 1. 3 are there: alpha 1, alpha 2 and beta 1. In this we will have shock and CHF. Shock is alpha 1, CHF is beta 1. Okay, shock and CHF, alpha 1, beta 1. In isoprenaline we have a CHD and bronchial asthma, beta 1, beta 2. In adrenaline we have high arrhythmogenic drug, right? Like this. Now we have anaphylactic shock and cardiac arrest. In anaphylactic shock, it will be IM more than SC and 1:1000. Okay, anaphylactic shock. In cardiac arrest, it will be IV 1:10,000. Okay, now we have anti-adrenergic drug. We have alpha 1, alpha blockers and beta blockers. Okay, like this we have, and we will be then this chapter will be closed. Okay, so in what do we have is in anti-adrenergic drugs we are non-selective, then we have selective. So first we are talking about alpha 1, right? In alpha we have non-selective and selective, and non-selective means it's not selective, so alpha and alpha 2 both will be there. So whenever we have both in this, it will be two things, either reversible or irreversible. So whenever we have reversible, okay, then it means it will be phentolamine, okay, tolazoline, and they are developed for cheese reaction or clonidine withdrawal. Okay, so and usually we have seen like MAO inhibitor, wine is there. Okay, these things will come. And in irreversible, phenoxybenzamine, it is used for pheocytochroma, phenoxybenzamine. Okay, so phentolamine, tolazine, Chinese cheese reaction. Okay, and MAO inhibitor. So and also second one was the clonidine. In the clonidine withdrawal, it's like so in this there will be sudden increase in BP, which will result in rebound hypertension or clonidine withdrawal. So this is a strong drug which is reversible. So that will be phentolamine, right? Now we have second, which one is the selective. Selective means all josin, right? Parazosine, doxazosine, alfuzosin, all these josins will be there. Then we have is in this there will be vasodilation and BPH. Okay, vasodilation will be mild to moderate hypertension, and scorpion sting, which is the drug of choice for josin. Second will be BPH. In this there will be pain, hypertension and pulmonary edema. Okay, so whenever we have drug of choice of BPH with hypertension, If it is with the hypertension, then it will be pra. Okay, whenever you have pra, then it will be with hypertension. If it is without hypertension, then it will be a tamsulosin, silodosin, which do not cause postural hypertension, right? Yeah. So other could be like scorpion sting, which is the drug of choice, right? Now we have hypertension and pulmonary edema. Two we have which is associated with scorpion sting, so that it will be managed by prazosin, right? And also we have finasteride. Okay, finasteride is the what? It is the ide. Okay, so that means in this this is 5 alpha reductase, and after giving this drug, prostate will not grow. Okay, if I want prostate not to grow, in that case I will give finasteride, that will be 5 alpha reductase, right? So with hypertension it was prazosin, and without it was tamsulosin and sildosin. Okay, now we have two things: either it will be non-selective or it will be selective, right? So whenever you have non-selective beta blocker, that means what? You have not selected, so both will become. When both will come, then it will be cardiac plus extra cardiac uses also non-cardiac. So both will be there. So that's why its contraindications will be asthma, diabetes mellitus. Okay, so this is the first generation, which is non-selective. Whenever you are selective beta blockers means it will be used only for cardiac use, and it will be uh, selective one only beta 1 blocker only. So in this it will be bronchus, blood vessel and liver. Bronchus it will be asthma, and and the blood vessel it will be Renault. Liver it will be DM, that will be second generation, right? So which of the following is a contraindication to the use of beta blocker, right? So if they ask contraindication of beta blocker, then it will be bronchial asthma, right? So asthma, diabetes mellitus, PVD. Okay, so beta blocker used in glaucoma. If they ask used in glaucoma, that will be timolol, TT, right? So we have so this also question comes like cardioselective beta blockers. Okay, so these were the things which we know, but we need to remember the drugs. First generation, second generation. Okay, so for the second generation we have new beta blocker act exclusively at myocardium. It will be like new means all lol will be there. Nebivolol, beta-oxolol, bisolol, all lol will be there in the second generation one. Then we have what? We have, so we were talking about contraindications, right? So contraindications of beta blocker in this first will be beta 1 and beta 2. Okay, so in beta 1 it was like rate conduction and contractility, all will decrease. Contraindications of beta blocker. And whenever it's beta 2, okay, so in beta 2 it will be like asthma, DVT, like this. Then we have indications, right? Then indications we have beta 1 and beta 2. Beta 1 was the cardiac indications. It will be hypertension, angina, MI, CHF. CHF will be chronic, angina will be classical. HOCM, beta blockers are contraindicated in variant angina and acute CHF. Okay. Beta 2 is extracardiac indications. Play the game. Play means performance anxiety, thyrotoxicosis, G is glaucoma, timolol, A is akathisia, M is migraines, prophylaxis is not TT, E is essential tremor, which will be propranolol. So we have A, B, C, D. A is asthma, B is block, C is CHF, D is diabetes. So these are all the things, and now we have the last thing which we need to know is the formation. Okay, about glaucoma. Glaucoma is very important topic, and this question has also come many times. So let's see about glaucoma. See, two things are there: either it will decrease the formation or it will increase the outflow. So whenever it will increase the outflow, that means it will be either trabecular or uvular scleral flow, right? So whenever it's trabecular, then means it's myotics, then it will be pilocarpine. Okay, whenever it's uvuloscleral, that means PGF2 alpha will increase, that will be latanoprost. This question is come, and drug of choice will be POAG, primary open angle glaucoma, right? And whenever it decrease the formation, then we can have another olquinidine in beta timolol. Okay, carbonic anhydrase we can use mide, zolamide. Okay, diuretics we have mannitol. When it comes to side effect, okay, in PGF alpha 2 we have latanoprost. Okay, and we have PGF and PGF alpha 2 only, which this is contraindicated in inflammation, uveitis. PGF is pigmentation of iris, growth of eyelashes. F is fluid in macula. Then we have myotics, CS. C is cataract, S is stenosis, cataract and stenosis of NLD. Then we have third is apreclonidine. Okay, so lid is there na, apreclonidine. So LID is there, so that it will be for lid retraction. Then we have brimonidine. BR is brain, EMO is infant, so apnea in newborn, that will be brain, right? So these were all the things which we have done. And regarding latent approach, this question has already come. Thank you. This chapter is done.